great to be here, and it's great to welcome you and help open this conference. We partner, so I'm Dean of the Bloomberg School of Public Health, and we partner with many organizations. But I can't think of an organization whose mission and goals are more consonant with what we do. So it's really a pleasure to be here and to help you welcome. It's a special day because you're celebrating your 10th anniversary as an organization, and we as a School of Public Health are celebrating our 100th. We start formally a week from today. We're going to have a year of commemorating both the history of the School of Public Health, but more importantly, help chart the future of what we do and what public health as a field does. And of course, given the events in Baltimore in the last few months, dealing with the issues of inequality and reducing inequality couldn't be more important and couldn't be more on our radar screen, given that we are here in the city of Baltimore and it's our home and we love it. We're going to use our centennial as a platform for creating this comprehensive plan that looks not only at Baltimore but around the world and a roadmap for how we reduce inequality. It's in many ways what you're talking about in this symposium as well, how you use the power of interoperability and working together and sharing data to reduce inequalities. I think many folks outside of our field don't appreciate how important the social determinants of health are. When I talk to friends and people in other fields, they often think of healthcare as the major determinant of health. And we all know we want the best healthcare possible. We want the best doctors, best nurses, best use of resources. But when you look broadly at health, the major determinants of health are social determinants, and they're including access to services, the policies surrounding health, policies surrounding environment, and policies relating to economic inequality. So we believe it's vital at our school to incorporate social determinants into our understanding of the factors influencing individual and population health, and as well as to include societal factors in our research, our policy, and our practice. Social factors, including economic disadvantages, exposure to violence, and other social inequities experienced by many of our citizens in Baltimore and cities around the world, have to be addressed through innovative programs that bridge health and human services. But how do we rebalance these strategies, policies, and funding sources so that the social determinants of health and wellness are really on the front burner, so that they receive a greater attention and more investment? Well, we have to collaborate. We have to share information. Talking about sharing information and interoperability here is like carrying coals to Newcastle. But we have to push that agenda across a broad range of programs and agencies. I think that this symposium today offers a great opportunity to further the advancement of interoperability across health, human services, and other sectors, including justice, education, and mental health. You've brought together some of the most forward-thinking thought leaders and innovators on these issues from academia, government, industry, the entrepreneurial sector, nonprofits, and tribes. And this conversation, which is really a national conversation, began about 10 years ago with the coming together of program leaders and advocates who are concerned about improving the sharing of data and services among child welfare agencies. But it's now become clear, as we pursued that agenda, you pursued that agenda, that every area of health and human services, from population health management to mental health to aging services to homeless services, is grappling with a similar set of interoperability challenges. Moreover, at the local level, many different service systems, such as Medicaid, food stamps, and temporary aid to needy families, may involve the same clients who try to navigate the requirements of multiple agencies with insufficient help in coordinating services to meet their complex needs. And much of this information that's needed still is in isolated data silos. So here in Baltimore, our school has about 170 funded programs, but we have programs throughout the world in over 100 countries. And it's very interesting as I look at the issues that you're facing today. They are the same in global health. So some of you are familiar, for example, with the PEPFAR, the President's Emergency Plan for AIDS Relief, or other health initiatives in global health where they create silos, a targeted program that goes in and creates a silo to try to solve one problem, which is admirable. but often steals resources from other programs. So weakens, for example, primary healthcare systems, other healthcare systems. And the big agenda in global health now is how we take those silos and we horizontally integrate them so that we strengthen all systems and create resilient and flexible systems. So the title of the symposium, as you all know, because you all got the same materials I did, is Harnessing the Power of Information Interoperability and Social Determinants to Advance Health and Wellness Integration. So that's a very long title. Not pithy, but important. And I think our speakers today are asking the right questions. What are the best models? What do we build on? And what can we reasonably attain over the next few years? How do we best provide integrated, more efficient, higher value services and achieve better outcomes for our clients, patients, and citizens, both now and in the future? Last year I told a story, I think it was last year, perhaps the year before, about that I have a daughter with autism, and in Maryland, when you graduate from high school, when you're 18 and graduate from high school and you have autism, you lose services, and then you get them again at age 21. It's a gap that you're all familiar with, and that in my working with my daughter to get services, I'm a physician. I make a very good living. I'm dean of a school of public health. It was incredibly difficult to navigate that. And some of the materials were just unbelievably opaque. And I'm not a paranoid person, but it did seem like they were designed so that I wouldn't get services for my daughter. And I often think that if I have those kinds of challenges, what about people without those resources, people without education, people without money, people without influence? So I think the next few days are going to be great. We're going to learn from each other's experiences and identify new ways in which we can pursue our collective goals. It takes vision, commitment, planning, and collaboration, and fortitude to effect enduring systemic change. This symposium brings together all these efforts. So we're going to get to work our school in the next year on Baltimore, and I know that you're going to get to work on this important agenda. So from one celebrant to another, happy anniversary. So.
Good morning. After years of a growing understanding of the depth and the breadth and the layers of what it takes to build a healthier, stronger society, the Robert Wood Johnson Foundation last year sort of embarked towards a new vision that calls on us as a nation to strive together to build a culture of health, enabling all in our diverse nation to live healthier lives now and for generations to come. So these seeds of change towards a culture of health, they've already been growing. We didn't start something brand new at the Robert Wood Johnson Foundation. We just put these words on it. And we developed a framework to help describe it and put some order to it that I'll describe later today when I get to talk to you some more about our work. But you can see that this change is already growing, these seeds of change. And you can see it right here at a conference like this, a conference where we're talking about people and organizations working together better, collaboratively using data and information, and doing so using approaches that address the social determinants of health, mixing interoperability and these broader systemic social issues. I don't need any better evidence of how the seeds of change are already growing. So it is a pleasure to be here with you and a few of my other colleagues from the Robert Wood Johnson Foundation in a room full of change agents. So I'm excited for the next few days, and it is a pleasure to be able to be a part of Stewards of Change for their 10th year symposium. So thank you.